Groups across the country are protesting efforts to permanently shut down all Veteran Administration hospitals. The closures are a new idea proposed by a group commissioned by the federal government to fix long wait times for healthcare services. News 8's Madeline O'Neill has the story from a local protest outside the Tomah VA.
Lisa, some health advisors that are part of a federal commission working to improve veterans' care have proposed closing down all VA medical centers and privatizing the care of veterans. Union members, employees, and veterans themselves hit the streets today, joining the fight to keep VA hospitals' doors open.
The VA means the world to me.
Veteran Jake Mason says he owes a lot in his life to the Tomah VA.
The VA helped me with my marriage. My children. I wouldn't have ever been married or had children if I would have still been addicted.
That's why he's picketing.
Ho, ho! Hospital closing got to go.
The Federal Commission on Care is developing recommendations for VA health care after reports of long wait lists keeping veterans from getting appointments. Now, some of the Commission's advisors think it may be best to give up on the VA system altogether. But these protesters want their voices heard.
Many of these are veterans, they're employees. Veteran care means a great deal to them. They know that some of our VA needs fixing, but they also know that we're the best at research. We're the best at a lot of these cares.
If the VAs are shut down and veterans' care is privatized, some worry the price of health care will go up and the quality will go down.
We want to see the veterans with the veterans in order to get well, because that's something that they can't do in the private sector.
Mason said he first began recovery in the private sector, and it didn't go so well.
Had a tough transition.
And it wasn't until he was able to get care with other veterans that things started to change.
He came here, had a great experience being able to be with fellow veterans and employees that actually knew what was going on.
He now works at the VA helping other veterans and is determined to stay there.
This VA isn't going anywhere.
The Department of Veterans Affairs has been in the headlines since 2014 when reports came out that the hospital couldn't keep up with appointments.
When do they expect to deliver the recommendation?
That should be next week on June 30th.
All right, thank you so much, Maddie.